students, my name is Neha Mittal. I am working as an assistant professor at Ramesh Institute of Vocational and Technical Education. In this video lecture, I am going to discuss anti-malarial drugs part 3. As we know that there are the many criteria or there are the many categories of anti-malarial drugs which are used to treat the malaria. In this slide, we will understand about the drugs 8 aminoquinolines. It contains basically two drugs, pamaquine phosphate and the pamaquine. Next, quinacrine hydrochloride and the last mefloquine. First of all, we will understand 8 aminoquinolines. So, as in my previous lecture, I explained that there are the two categories of the substitution at aminoquinolines. One substitution takes place at the 4th position, leads to the 4 aminoquinolines, examples are chloroquine, whereas the second substitution takes place at the 8th position, known as the 8 aminoquinolines. So, in this lecture, we will focus on the 8 aminoquinolines. 8 aminoquinolines is a large class of anti-malarial medications which are based on the quinoline alkaloids found in the cinchona tree. This group of drugs has an amino group substitution at 8th position. We see that there is a substitution of amino group at a 8th position. There are the basically two drugs, one is pamaquine and second is pamaquine. Pamaquine was the first drug which was introduced in this category, but now it is no longer used because of its side effects. If we talk about the structure activity relationship, then we will see the importance of quinoline ring present in the 8 aminoquinolines. Presence of quinoline ring is essential for the anti-malarial activity. If this pyridine ring gets converted into the piperidine ring, if it is converted into the piperidine ring, we see that there is no activity of anti-malaria. Next, we will see the importance of side chain at position 8. We see that addition of side chain increases the activity as we see in the case of pamaquine. Here we found that pentyl 5 carbon side chain has shown maximum anti-malarial activity, whereas if we increase or decrease the side chain length, so it decreases the anti-malarial activity. Next, we see that if the branched side chain, if the branches are formed, so if the branched side chain is converted into the straight chain, as we see in the case of pentaquine, so it leads to the decrease in the activity. Next, we will see the importance of terminal amino group. We see that if there is a substitution of primary amino with tertiary amino, it results in decrease the activity and increase the toxicity. In the pamaquine, there is a presence of primary amino group, but in the case of pamaquine, we see that there is a presence of tertiary amino group. So, substitution of primary to tertiary leads to decrease in the activity and increase in the toxicity. Next, we see the presence of primary amino group has been shown the maximum activity, means this primary group has shown the maximum anti-malarial activity of the drug. Third, we will see the substitution at position 6. What happens if we do the substitution at position 6? Here we will see methoxy group is necessary for the optimum activity. If this methoxy group is substituted with the ethoxy group, if this methoxy is substituted with the ethoxy group, we found the reduced activity. In the same way, if this methoxy group gets substituted with the methyl group, it leads to loss of activity. कोई activity नहीं रहती है. Next, अगर इस methoxy group को किसी halide के साथ substitute करके देखा गया, so we found it leads to the increased toxicity. So this methoxy group is optimum for the anti-malarial activity. Next, substitution of pamaquine. We see that if we do the substitution of benzyl oxy at position 2, it leads to decrease in the activity. If there is a substitution of phenyl group at position 3rd, if there is a substitution of phenyl group, it also leads to reduction in the activity of anti-malarial drug. Next, substitution of methyl group at position 4 leads to almost 2 increase in their activity, and substitution at position 5 leads to decrease in toxicity while having almost same activity. And last, if there is a substitution done at position 7, if there is any substitution done at position 7, it loss of activity. So, this is the structural activity relationship. Next, we will talk about the mechanism of action. We see the 8 aminoquinolines include the pamaquine and the pamaquine. They shows their effect at the erythrocytic stage of the Plasmodium ovale as well as Plasmodium falciparum. They are effective on the exoerythrocytic stage. What they do? They obstruct the gametes which are found and which basically helps in removing to form required help in removing the infect the mosquito carrier. If this gametes, we will see that if the gametes do not form, so the next parasites or next mosquito which bite to a infected person is not able to spread the malaria anymore, because there is the obstruction, there is a destruction in the gametocyte stage. So, it also dislocate the parasite's electron transport chain through generating the reactive oxygen. It is responsible for the formation of free radicals. These free radicals or these free reactive oxygen disturb the electron transport chain in the parasites. Then there is no formation of the purine and pyrimidine bases, hence it leads to the death of the parasite. It is not given for those patients which has erythrocytic glucose 6 phosphate dehydrogenate deficiency. जिन पेशेंट के अंदर इस एंजाइम की कमी होती है, उन पेशेंट्स के अंदर इस मेडिसिन को देना कॉन्ट्राइंडिकेटेड होता है. नेक्स्ट वी विल डिस्कस अबाउट द सिंथेसिस ऑफ pamaquine. If we see the synthesis, so we take the example, here we see 8 amino 6 methoxyquinoline, 8 amino and at the 6th position there is a methoxyquinoline. It gets react with the 2 chloro and the diethyl, 1 ethyl and second ethyl, which are bound to the tertiary amine. So, 2 chloro diethyl amino pentane, when these two molecules get condensed with each other, there is a formation of pamaquine. Next molecule is acridine. The next drug is acridine, which is also known as quinacrine hydrochloride. Quinacridine is formed when an additional benzene ring is attached or is fused with the pyridine ring of quinoline. It is a 3 ring structure and there is a substitution. We see 9 amino acridine. There is a amino group at 9 position. There is a addition of amino group at 9 position. It is a green fluorescent dye, and in the past time its compound was used as antiseptic for treating the wounds infection. Next we will see the structure activity relationship. So, we see that various types of acridine were synthesized. They have the weak antiseptic and antibacterial activity. Acridine ring is substituted by a chloro group at position 6. At 6th position they are substituted by the chlorine group, and at number 2, if you see that at number 2 and at number 5, there is a presence of diethyl, 1 ethyl, 2nd ethyl. So, there is a presence of diethyl which is associated with the tertiary amine. So, at 5th position it is substituted by diethyl amino pentane. So, it is a pentane 2 yl nitrilo group at position 9th. So, this is a 9th position. There is a substitution of 5 diethyl amino pentane 2 yl, which gives the antimalarial compounds. Quinacrine was the first synthetic agents that was used before quinoline. If we see next, when methoxy is shifted to position 6 and chloro to 2, if we do the interchange, then we found that there is no antimalarial activity found. When this methoxy, which is present here, when this methoxy get replaced by the ethoxy, we found that the toxicity was increased. When methoxy is rotated to any other position 1, 2, 3, then almost it was found that 50% activity was lost. When we talk about this electron withdrawing group, if this electron withdrawing group, that is chlorine, was replaced by the other halogens like bromine, iodine, so we found that there is a loss of activity. If we talk about the mechanism of action, then quinacrine binds to the deoxyribonucleic acid DNA by intercalation between the adjacent base pair. So, there is a base pair present. What it do? It binds with the base pair and hence it binds with the DNA. Then what happened? There is an inhibition of transcription and translation. Transcription and translation is very important for the survival and growth of the parasites, because there is a formation of DNA, RNA, and there is a formation of protein which is responsible for the nutritional aspect. Quinacrine also inhibit the succinate oxidation and it also interfere with the electron transport chain. Electron transport chain is the last step where NAD and FADH2 get reduced in the to form the ATP, that is adenosine triphosphate. In addition, we see that when it by binding to nucleoproteins, quinacrine suppress the lupus erythromatous cells factor and act as a strong inhibitor of cholinesterase enzyme. So, by this mechanism it is responsible for the death of parasitic malarial parasites and it shows the antimalarial activity. If we talk about the uses, it is used as an antimalarial drug, but superseded by chloroquine in recent years. It is also used as anthelmintics. So, this is all about the mechanism and uses of the pamaquine. Next, we will see the mefloquine. The next drug is mefloquine. Mefloquine is a quinoline methanoline derivative. If we see, then there is a addition of, it has antimalarial and anti-inflammatory action, and if we see the substitution, if we see about the substitution, we will see that there is a substitution at position 2 and position 8. At position 2, we see that there is a substitution of trifluoromethyl along with at position 8, we will see 1, 2, 3, 4, 5, 6, 7 and 8. So, we will see that at 8th position and at 2 position there is a substitution of trifluoromethyl. Along with we will see the addition of 2-piperidinial hydroxymethyl substitution at position 4. So, these are the 2 substitution, one is with the trifluoromethane and the second substitution is with the 2-piperidinial hydroxymethyl group. If we talk about the properties, mefloquine hydrochloride is a white or slightly yellow crystalline powder, very slightly soluble in water, soluble in methanol and in alcohol, and the melting point is 174 to 176 degrees Celsius. If we talk about the metabolism, so it is in the liver, it gets metabolized with the help of this enzyme and it is metabolized to carboxymefloquine, which is a metabolic product of mefloquine. These products get metabolized and the remaining part of the drugs get excreted out from the body with urine. Mechanism of action, if we talk about the mechanism of action, we will see that they are the sporozoites which are located in the salivary gland of the mosquito infected with malaria are introduced into the bloodstream of the host to which the mosquito gets bite. These sporozoites rapidly invade the liver and then they mature themselves and they goes to the erythrocytic form where they infect the red blood cells. Mefloquine is an antimalarial drug which act as a blood syngentocytes preventing and treating the malaria, or we can say that they act in the erythrocytic stage of malaria. Mefloquine specially targets the ATS part of the ribosome of the Plasmodium falciparum, which inhibits the protein synthesis and subsequently responsible for the death of parasites. It is contraindicated to the patients which has the history of depression, anxiety disorder or any other psychiatric disorder. If we talk about the side effect, then we found that there are the few side effects like fever, headache, anxiety and fatigue. The person feels very low, headache होता है and he feels उसको बहुत ज़्यादा थकान, fatigue means he feels very tired. If we talk about the uses, so Lariam is a drug, it contains the mefloquine hydrochloride, is an anti-malarial drug available in a 250 mg tablet of mefloquine hydrochloride which is active in oral administration. It is used for the treatment of acute malarial infections. In the same way, Lariam, that is mefloquine, is indicated for the prophylaxis, for the preventive purpose of chloroquine resistant प्लाज्मोडियम फेल्सीपेरम के वो स्ट्रेन्स जो क्लोरोक्विन से रेसिस्टेंट हो गए हैं, they are used in that cases. Mefloquine, an anti-malarial drug with simple yet interesting structural features, is also used in the treatment of Mycobacterium tuberculosis. Thank you so much. I hope you learned a lot from this video lecture. In my next video lecture, we will discuss about the anti-malarial part 4. There are the few remaining drugs under this category. So, keep watching and see you in the next video lecture with anti-malarial drugs next part. Thank you so much.